People are drawn to the practice of medicine for many different reasons. It's a broad field, and everyone chooses the path that interests them most. Regardless of our various and diverse backgrounds, we all want to make contributions to our communities and improve the quality of care delivered to the people around us. Primary care physicians are in a unique position to do this through their very personal relationship with patients. To most people, the word research means working in a laboratory, but much of the research we do in primary care settings, like your own doctor's office, leads directly to improving the quality of the care we deliver around the world. Primary care may be a great fit for you, and there are a number of organizations to help you succeed in this field. We stand on the shoulders of pioneering physicians. Many significant contributions to modern medicine started in primary care offices with people like Dr. James McKenzie and Dr. Curtis Hames, whose innovative work advanced our understanding of failing hearts, conditions like atrial fibrillation, and cardiovascular disease and strokes, respectively. While historically physicians operated in the vacuum of their own practices, today we have many connected organizations to move these emerging ideas forward. Primary care practice-based research can be very rewarding. There is surprisingly little awareness among students, residents, and practicing physicians of the great organizations that facilitate and nurture primary care research, including the North American Primary Care Research Group, the American Academy of Family Physicians National Research Network, the Canadian Primary Care Sentinel Surveillance Network, and numerous regional practice-based research networks. These networks are excellent at providing young researchers with the support and skills they need to succeed either by themselves or in collaboration with their colleagues. Students, residents, and practicing physicians can get involved in ongoing research of interest to them through a mentoring process. You will contribute to these projects while learning some of the basic skills seasoned researchers have acquired through years of ongoing work in their respective fields. Eventually, this could lead to writing and publishing in peer-reviewed journals. Through this mentoring process, the ability to formulate researchable ideas, collect and analyze data, transform practice, and publish in a research journal isn't such a daunting task. The process provides a perfect proving ground for students and residents who want to be a clinician and researcher. Picture yourself in an innovative primary care practice with a multidisciplinary team interconnected with an advanced information technology system working together to pursue a researchable idea and have another team partnering with you to support your research. Primary care physicians collaborating with academic researchers, thought leaders, and heads of government agencies provides for a fertile exchange of ideas and makes the practice of medicine much more rewarding. These physicians make a serious contribution to their discipline on multiple levels, in addition to improving the care of patients in their practice and community. This is the world of primary care today, and you're invited to join. It's understandable that medical and surgical specialties and subspecialties have driven our biomedical and research efforts for a while now. However, only 1 in 1,000 patients ever ends up in one of our highly specialized hospitals. Those flagship hospitals and research institutions have done a wonderful job of treating patients with serious life-threatening diseases, but the majority of healthcare is practiced outside of those ivory towers. Primary care is where you're likely to have the greatest impact on the most patients. Throughout the world, primary care physicians are under intense scrutiny to improve patient care at a reasonable cost. This is a time of great change and also great opportunity. We need more students, residents, and practicing physicians to get involved in primary care research partnerships to navigate our ships through the challenges ahead. In our perfect world, every physician would be involved in primary care research and practice improvement, and more importantly, every patient would be involved too. For many years, we have neglected the patient voice in our research efforts. Patients have highly valuable insight and should be involved from the creation of a researchable idea all the way through to giving input to writing a paper for publication. No one in healthcare has a greater opportunity to build strong, trusted relationships with a wider array of patients than the primary care provider. With help from organizations like the AAFP's National Research Network, NAPCRG, and CPC-SSN, more physicians and patients are connected to research and raise their collective voices more loudly in pursuing researchable ideas. Think of the power and resources primary care physicians and their patients represent. You have the opportunity to become part of this community, tap into our collective resources, and collaborate on a national and international level. You can have a tremendous impact on your respective communities and improve the health of the people around you. We hope you'll join primary care in exploring this brave and exciting world.